Good morning. My name is Dr. Ralaiarivony Malala Olga. I am from Madagascar, presently in Togo Lomé, for a training in cataract surgery in Lumière Divine NGO.
À l'ONG Lumière Divine. J'ai découvert cette formation.
I discovered this training in cataract surgery in the Lumière Divine NGO
L'ONG Lumière Divine par une rencontre fortuite avec Dr.
by a fortuitous meeting with Dr. Odome Abraham. He just came for a brief meeting of local ophthalmologists in my country, and I was among them. It was just for a short period of 5 days and for 5 surgery sessions. So I see this occasion to pursue in Togo Lomé with Lumière Divine NGO.
À Lomé avec l'ONG Lumière Divine. Quand je suis que j'ai été acceptée,
when I knew I was accepted for the training and I received a confirmation mail from Dr. Odome Abraham,
j'étais vraiment contente.
I was very excited and very happy.
C'était une surprise.
It was a surprise for me, and at the same time, it was like something that was impractical. But this was like an open door for me to improve my competence in cataract surgery. Regarding the content of my training, there is 3 activities. The first one is the consultation with Dr. Odome, where we did patient approaches for surgical cases, preoperative and medical cases in ophthalmology. The second activity was on wet lab. We do master surgical gestures with artificial eyes and pork eyes. Thirdly, you are witnessing what is called surgical observation with the doctor, which is already in training, but we observe the gestures step by step on the screen, and we do that for 3 weeks, but this lasted for 1 month. After that, we started the main surgery training with the coach supervision, who accompanied us step by step. The step by step I'm talking about is the tuning incision, the crystalline lens extraction, and the insertion of the artificial implant in place of the crystalline lens. What surprised me during this training was the internal organization of the NGO team. Their way of working also put us at patient disposition for the surgery, as well as the coach disposition, who is always available from the beginning to the end of every session. And thirdly, I think the NGO platform is very sophisticated, and that was what helped me to do everything till the end of my training. I am able to do everything because they put on my disposition all the necessary materials to improve my competence at the end of my training.
À point pour une vraie compétence à la fin de la formation.
Like every training, I faced some difficulties during my training. How to abandon my old habits and to pass to another method of cataract surgery. But I was able to abandon it thanks to my coach. Secondly, there is an autonomy phase where I needed to operate alone and face all the complications. But with the help of my entourage, the paramedics, colleagues, and coach, I was able to pass this stage. I will practice all these acquired skills once I arrive my hospital in my country, and I will also increase the numbers of cataract surgery done in my home country. In addition, I will also work with the NGOs who promote eye health to help the disadvantaged population.
Je pense que cette formation doit être
I think this formation must expand to ocular health professionals and ophthalmologists like us, and also to students because this training helps to improve our surgery competence in cataract, which will complete the theory that we already learned in the university. We don't always have the possibility to have a big number of cataract surgeries to acquire these skills during the university course or during the cataract training itself. So I will invite other ophthalmologists who struggle to have a good result in their everyday work to do this training. To become a good surgeon, we have to operate on many eyes or do many surgeries. So this training on cataract surgery must be spread. It must be part of a training followed to all the theory of cataract surgery learned during our years in the university.
J'invite les jeunes médecins, ophthalmologistes à s'élancer.
I invite the young ophthalmologists to do this training because you cannot become a good ophthalmologist or a good surgeon automatically. For me, to become a good surgeon or a good ophthalmologist, you must do different cases of cataract surgeries. And then the training we have here at NGO Lumière Divine allows us to do all the complicated possible cases of cataract surgery. So it's very important to do this training if you want to become a good surgeon or a good ophthalmologist.
Chirurgien, en même temps, je dirais un bon ophtalmologiste.
Partie 8. I invite the young ophthalmologists to do this training because you cannot become a good ophthalmologist or a good surgeon automatically. For me, to become a good surgeon or a good ophthalmologist, you must do different cases of cataract surgeries. And then the training we have here at NGO Lumière Divine allows us to do all the complicated possible cases of cataract surgery. So it's very important to do this training if you want to become a good surgeon or a good ophthalmologist.
Merci.